Okay, so knock, knock, knock. I'm performing in hygiene. Hi, I'm Emily. I'm a student nurse from Harper. How are you today?
I'm doing well.
All right, so I'm here to do an assessment of your mental status and cranial nerves. So it's kind of like a neurological assessment. Is that okay with you?
Yeah, that's fine.
All right, so I'm going to start off by asking you a couple questions. When you're stressed, do you feel like you are able to cope well?
Yeah.
Okay, what are some things you do to cope then?
I take a walk, just some simple exercises.
Alright, good. And then do you have any family history of mental illness?
No.
Any personal history of mental illness?
Nope.
Alright, good. So I'm going to start off the exam with appearance. First off, he's dressed well for the situation. It was a little chilly outside. He has sweatpants and a t-shirt on. He's well groomed. His posture and body positioning, he's sitting erect. He's comfortable. And his body movements, he's not restless. They're coordinated and deliberate, which is within normal limits. And then if I were to go to his behavior, he's calm. He doesn't have a flat effect. His facial expression, he's smiling, and he's not normal, or he's not abnormal as in aggressive or combative. He's cooperative. His mood is pleasant, and his speech, he was just talking to me, it's clear, it's not rapid, and it's understandable, which is all within normal limits. And then if after that I would check your orientation. So do you know who the president is?
Currently it's Donald Trump.
Alright, good. And then do you know where you are?
Yes, we're at your house.
Alright, and then do you know why we're here?
We are doing a neurological assessment.
Okay, and then do you know what time of day it is?
It's evening. I think it's 8.
No cheating. Okay, yeah,
okay.
So it is evening time. It is 5 to 8, alright?
Okay.
So it's good. And then his level of consciousness, which would have gone with behavior, is that he's alert. And then I'll check your memory. So for remote memory, which is not recent memory, do you remember what your first job was?
It was busboy.
Alright, good. And then for recent memory, approximately, like, what time did you get to my house?
Around 5.
Alright, good. So then the next thing we do is we screen for anxiety, depression, and any suicidal and or homicidal thoughts. So with everything with COVID and the election and the stock markets going up and down, have you experienced any kind of anxiety, like restlessness or excessive worrying?
Not excessive. I am worried about my stocks, though.
Okay.
Tesla went down.
It did go down a lot. Well, is it unbearable then?
No.
Or does it prevent you from performing any activities in life?
No.
Or getting out?
Nope.
So you're able to manage it well?
Yep. Like I said, I just take my walks.
You take your walks. Alright, good. Alright, so it's good that you mentioned that you did have some anxiety. It's important that you tell me that so we can help you. But it's also important you mentioned you're coping with it well. For depression, say again with COVID, the elections, and a lot of stress going on, or issues like going to clinical and not going to clinical type things with school, have you like almost lost interest in things you enjoy?
No.
Or have you been feeling just plain down or hopeless?
Sometimes I feel down, but nothing like to the point where I can't get back up,
Okay, what are some things you do when you feel down?
Well, sometimes I let myself feel down for a moment. So sometimes I'll be like, alright, well, I'll take a lazy day. So, but then next day it's back to it, whatever we need to do.
Okay, that's good. It's good again that you told me that. It's important that if you were feeling more than hopeless, that we could get you some help. But you said you do get down, and plus you're also anxious. Have you ever had any thoughts of just in general not wanting to be here anymore?
No.
Okay, good. And then if he had said yes, I would go on to asking more in-depth and precise questions about suicidal ideation, but since you said no, we can move forward. But have you had any, with the depression, sometimes people can get angry and channel their sadness that way. Have you ever had any thoughts of harming somebody else besides yourself?
No.
Okay, good. And that would be screaming for homicidal ideation or thoughts. Alright, so now we're going to get to the cranial nerves. Cranial one is olfactory. We're not testing that now, but I learned on Monday's lecture that they test it by having you sniff pepper, which is something they're doing a lot with COVID testing. So I'm going to go to cranial nerve 2. So 2 ways we can test that is with visual acuity with the Snellen chart, where you have him stand 20 feet away, read the numbers, cover one eye, then cover the other eye. And then another way I can test that is with your peripheral fields. I'm blanking on the name, it'll come to me in a second, but we're going to test that right now. So, I'm just going to rip this in half because I forgot to bring 2.
Okay.
Alright, so if you could cover your left eye and tell me when you feel, or tell me when you see this.
I see it.
Okay.
I see it.
Okay. I'll stoop down to your right.
I see it.
Okay. And then.
I see it.
Good. So he was seeing things the same time I was seeing my hand come into view. And then if you cover your right eye, we're going to do the same thing. And I'll crouch down just a little bit.
Okay. I see it.
Okay.
I see it.
Okay.
I see it.
Okay.
And I see. Wait. I see it. There you go.
You see it there?
Mm-hmm.
Okay. So that was approximately when I saw it. This is testing his peripheral vision. I'm blanking on the name. I'll write it in the YouTube comment. Alright, so now we're going to do cranial nerves 3, 4, and 6. So these are your eye movements. So I'm going to start with the 6 cardinal gazes. And I want to not see any shaking of the eyes. I want to just see a free flow and equal and coordinated eye movement when you do this. So just follow the pen here. Good. Good. 1, 2. Good. So that was the 6 cardinal gazes. His eyes move bilaterally and equally. There's no nystagmus or delay in the eye movement. He was able to follow my pen, which was well coordinated. And then we're going to test for accommodation. So what I'm looking for here is that his pupils constrict and that they converge towards the nose. Alright, ready? Just follow this. Alright, and good. They were bilateral movement. He was able to follow the pen. Pupils constrict. And then, if you could take, or I guess you could leave your glasses on. You can take them off.
Take them off, yeah.
Alright, I'm going to check your pupillary light reflex. So I'm going to place my hand here and I'm going to shine the light. Good. And I'm just looking for constriction of the pupils. Good. Alright, and both pupils constricted equally. His pupil size isn't extremely dilated or constricted, and that's within normal limits. Alright, now we're going to come to cranial nerve 5. I keep pulling out my cotton ball. Alright, so cranial nerve 5, I'm going to have you clench your jaw, and I'm going to feel right about here. Alright, clench your jaw. Alright, good. So when he clenches his jaw, both of the muscles tense up equally and bilaterally, which is normal. And then I'm going to take my cotton ball and I'm going to touch your face, and because this is a sensory part of cranial nerve 5, so you tell me if you feel it, okay?
Yeah, I feel it.
Okay.
Yep.
You feel it?
Mm-hmm.
Alright, how about now?
I feel it.
Alright. Good, good, good. So that's cranial nerve number 5. We already did 6. So we're going to come to 7. So cranial nerve 7, I'm going to have you smile, frown, close and open your eyes. Good. Raise your eyebrows, lower them, and then show me your teeth. Alright. Alright, good. A growl. Okay, good. So that's normal. Again, someone with Bell's palsy or damage to the cranial nerve 7 would not be able to raise up their eyebrows. So cranial nerve 7 is intact. Alright, cranial nerve 8, we're going to do the whisper test. And this is for hearing. So I'm going to whisper a couple things and then you tell me what you hear.
Okay. Election day.
All right, good.
November 3rd.
Good. So cranial nerve 8 is intact. He was able to successfully repeat the words back to me. All right. Now we're going to go to cranial nerves 9 and 10. So I would have my mask on for this because he's opening his mouth, but I don't have it on right now. So if you could open your mouth and say ah. All right, so perfect. Cranial nerve 9 and 10 are intact. I see the rise and fall of the uvula and soft palate, which is completely normal.
Sweet.
And then for cranial nerve 11, I'm going to have you tilt your head against, just press against resistance by turning your neck. No, like, turn your neck. Yes, like that. Okay, good. Good. And then your shoulders push up. Good. Cranial nerve 11, the muscles are equal bilaterally, the strength against resistance, and that's normal again. Last but not least, we have cranial nerve number 12. Alright, so if you could just stick out your tongue for me. Alright, easy. His tongue is midline, and cranial nerve number 12 is intact. Alright, so that wraps up our assessment for today. Mr. Wan, thank you. And I'm going to perform my hand hygiene and leave.
Sweet.